And special greetings to all media houses here and those who are joining us via Zoom. And Dr. Zungu, the acting HOD for the Department of Health, also joining us through Zoom, currently in Port Elizabeth. Good morning to you all. As we're nearing the end of year 2020, we can all agree that this year was not what we had hoped for when we exchanged prosperous New Year pleasantries at the beginning of the year. What visited the world, our country, and our province in March in the form of the COVID-19 virus messed up our normal lives, our livelihood, and our economy beyond our wildest imagination. The worst and most painful effect of this COVID-19 pandemic is that many of our people lost parents, children, siblings, friends, colleagues, the loved ones, and relatives. I would find it extremely odd if one person in the province has not been affected in one way or another by COVID-19 pandemic. If it has not infected you, surely it has affected you, whether socially or economically. As we wrap up this dreadful year, we are going to share with you crucial information which we want our people to be aware of and use it to protect themselves and their families as they enjoy summer holiday break. I do not want to call this holiday break a festive season because there is absolutely nothing festive about this year. Our data analysis at the moment indicates that since March, 767,000 people have been infected by COVID-19 in our province. Of these, 139,264 people recovered from this virus. We therefore currently have 14,251 active cases in our province. Quite important for our people to note at this stage is where these active cases are concentrated. They are mainly in Buffalo City at 2,737, Christiani District at 2,107, OR Tambo District at 2,143, Nelson Mandela Metro at 2,095, Sarah Batman at 1,882, Amatole District at 1,764, Alfred Nzo District at 1,085, and Joe Gabi District at 259, in that order. So if you are in any of these districts, we have one advice for you. Zigade. Ubomi bakho nabo obathandayo busengozini. Asingethandi ube ngomnye wabantu beliphondo lethu abayi-6,252 abathe babulawa yile ntsholongwane bashiya iintsapho zabo zipheleke imiphefumlo. Amakhaya amaninzi azochitha iKrismesi yalo nyaka ngaphandle kwamanye amalungu osapho asutywe yile ntsholongwane. These families include those of traditional leaders, academics, church leaders, our public representatives, and our most valuable frontline workers. Names of Professor Balintulo, Bishop Matyumza, BCM Deputy Executive Mayor, Councillor Matana, Nelson Mandela Metro Councillor Mike Kwenite, who is being buried now as we sit here, Chief Dumelu Sotu, Wamachachu, kwakunye nomhlekazi uqaqambile Siyongwana, oyingcibi yamakhwenkwe esimazi kakhulu sonke. Indeed, our traditional surgeon who has raised the bar in that space. These are some of prominent names that we have lost recently. The impact of COVID-19 has also been felt severely in the provincial administration. MEC Manilu City, MEC Gade for education, and MEC Gomba for health are the latest members of EXCO who are still battling with COVID-19 after they tested positive. We wish them, together with all people who are battling with this virus, a speedy recovery. There are also 13,177 employees of the Eastern Cape Provincial Government who contracted COVID-19, and 11,372 of these people have since recovered from the virus. Hence the EXCO decision to release all government employees except essential and critical staff to work from home. But sadly, we have lost about 348 of our colleagues. May their families continue to heal from these losses. Clinical audits of SARS-CoV-2 related deaths are taking place in the hospitals, and back capturing has started recently to improve the reporting on the deaths, noting that some of our people die at home and some die on their way to hospitals. We'll share the information about the outcomes of this clinical audit soon. We are also engaging our local universities to have a look, or to look deeper into the causal factors of high deaths that are not related to comorbidities through the research. That said, there are measures that we are undertaking to protect ourselves and our loved ones from getting infected with the virus. These are not new measures at all. We embraced them with maximum discipline between March and September. And the results were phenomenal because we reduced the number of active cases drastically in our province to around 1,500 and less by end of September. We were not helped by a vaccine then, and a vaccine is not yet available to help us now. We must therefore adhere to the 4 basic non-pharmaceutical protocols, which I will remind you about. The first one is the wearing of masks in public and around other people. At all times, people must wear their masks correctly. By wearing it correctly, we mean do not put it under your nose or under your chin. Cover your nose with it. Sicela abantu bakuthi banxibe ii-masks xa bekwindawo ezinabantu abaninzi, nanxa bekwindawo eziphakathi kwabanye abantu noba bambalwa. Ngamaxesha onke mabazinxibe ii-masks zabo kakuhle, bazinxibe zigqume iimpumlo zabo, bazinxibe zikhavarishe izilevu zabo. Sicela loo nto ebantwini. Secondly, we urge our people to again observe social distancing and to avoid large gatherings. Sicela abantu bakuthi bazigweme kwiindibano ezinabantu abaninzi, noba zezobumnandi, noba zezobubi ukungonwabi, kodwa kwindawo enabantu abaninzi ngeli xesha khawuzinqande ngokwakho uhlale endlini. Thirdly, we implore people to again stay at home as often as possible. Lastly, let us return to washing or sanitizing our hands regularly. Siyacela kuba iscience isixelele into okokuba the more uhlamba izandla zakho at least nge-20 seconds uzivasa ngesephu unazo ii-chances ezinkulu zokokuba usincedise ekulweni nale ntsholongwane. So le nto yokuhlanjwa kwezandla nokusanitizer ibalulekile. Ndithandile ke ndibabonela abantu bakuthi ezilokishini nasezilalini bahamba kunye nezimehlane zabo zesanitizer zezipokothini. Umntu noba usemcimbini ukhupha isanitizer yakhe encinci azimfavathe ngayo. Siyayithanda ke loo nto, siyayikhuthaza nokuba abantu banxibe ezi mask kangangoko. The resurgence in COVID-19 cases is not a result of government easing regulation to alert level 1 to enable economic recovery. We are in this resurgence simply because people stopped practicing these 4 basic non-pharmaceutical protocols that fundamentally disrupted the transmission of this virus between March and end of September. Abantu bakuthi bavele bayeka ukoyika i-COVID. Iyasibonisa ke ngoku kuba isakhonya le COVID. Ukungathotyelwa kwemiqathango emiselweyo ezifihlweni, ezicaweni, kwiindawo zolonwabo nakwiindawo zentengiso jikelele kuko okusibuyisela umva. Sicela ke abantu bakuthi basincede ngokuqinisekisa uba le mithetho imiselweyo yiyo eyakusikhupha kule ngingqwa okanye kule ngxingwa sizibona sikuyo kwakhona. Masibuyeleni kulaa nto besike sakwazi uyenza ngempumelelo. While on this point of non-adherence with regulation, I want to appeal once again to our people to bury their loved ones within 72 hours, like we did during the first wave. Asichazi nje imingcwabo ye-COVID-19, sichaza nje kwasingcwabo. Kuba kuyathanda ukudifferentiate pha, hayi esi singcwabo sesomntu osweleke normal. Isingcwabo ingxaki yaso siyingozi kwaba baphilayo. Asiseyongozi kulo uswelekileyo. Sizama unqanda aba baphilayo okwakuzila kweveki ezimbini abantu behleli okanye ukuzila kweveki abantu befamily bequndene kweli khaya. Sicela loo nto nokuza kwabantu ezifihlweni. So lo 72 hours uyasinceda kokuba sikhawulezise imingcwabo siyibeke ecaleni. Okanye abantu xa bengakwazi ngezizathu ezahlukeneyo zefamily ukungcwaba nge-72 hours bamqhusheke umntu wabo, bakwazi ukulungiselela ke lo mngcwabo khona ukuze amalungu efamily akwindawo ngeendawo abe nakwazi ufumana ithuba lozowunika imbeko. Osikukhuthazayo yinto yokokuba imingcwabo le make siyenze ingabi yimicimbi, siyenze ibe ngumngcwabo, sinike imbeko nesidima kulowo uthe wasandulela. Kwaye le mingcwabo sirhalele into yokokuba iqhutywe ngala 2 hours ebesiyiqhuba ngayo ukusukela ngoMarch uyotsho ngoSeptemba. La 2 hours ibisinceda ukukhawulezisa izinto noba abantu bakhona ukuqinisekisa into yokokuba loo manani akhoyo kangangoko siyayazi uba le virus iyakwazi ukuphuma ingene ebantwini kwi-15 minutes, kodwa ukucutha ixesha okusithetha ngako kukuzama ukuthintela unongekehli. Funerals are one of our super spreaders of COVID infections. Kulapho le ntsholongwana isasazeka khona okomlilo wedobo. Most people go to funerals and days after they get sick, and most do not survive. Abantu baya emngcwabeni, ingakumbi abantu abadala, babuye emingcwabeni bagule and uninzi lwabo luyasweleka. That is how severe infections at funerals are. Andiqondi bukhona kumntu orhalela uthi xa enika imbeko yokukhapha umntu amthandayo ashiyeke enegama nebali elibi lefemeli okokuba abantu abaninzi basuleleka kulaa family, abantu abaninzi basweleka yile ntsholongwane abayifumene kulaa family. So thina zi-families masiyazi uba sinoxanduva ngemingcwabo yabo sibathandayo ukukhusela isizwe nokukhusela abantu bokuhlala kule ntsholongwane. Siyacela ke abantu kangangoko bekwazi ukuqinisekisa into yokokuba siyasebenzisana kwaye siyayinqanda le meko esiyibonayo engantlanga. That is how severe indeed these funerals are. Families and reverend must conclude burials strictly in 2 hours. Siyacela ii-families nabashumayeli nabangcwabi mabancedisane nathi imingcwabo siyiqhube ngeeyure ezimbini. Masibambisaneni ngaloo nto. Umngcwabo uqala ngo-8 ngo-10 umngcwabo uphumile. Wonke umuntu ebezazi bufanele bubheke emngcwabeni akanoza athi umngcwabo uqale eli kakhulu. Let me now highlight our state of admissions in our hospitals because there's been an extensive reports in the media about shortages of beds. From the onset, let me assure the people of our province that our hospitals are not full. They are not overflowing because of high numbers of people admitted as a result of COVID-19 related sicknesses. The average daily admissions have decreased by 46.6% from 204 admissions on the 14th to 109 on the 21st of December. We are now seeing less admissions of patients than we did on the 10th of December. Currently, the number of patients admitted in both public and private hospitals in the province is 1,795. Public hospitals have 1,211 people admitted. Private hospitals have 584 patients admitted for COVID-19 related sicknesses. In public hospitals, there are 1,663 patients in general wards. We have decanted all our hospitals. We do have COVID-19 beds that we decanted. You remember that during a first wave, what we did as a province was to say, let's look for legacy out of this COVID. Instead of just establishing or developing these field hospitals anywhere, rather let's invest in the current health care facilities, improve, facelift, add more beds. That's what we did. And that work was done, and those beds are coming in now handy to improve our capacity to handle the situation that we are confronting in this second wave. "23 of these are in ICU and 18 on ventilators, 25 patients in high care. In terms of the patients admitted in private hospitals in the province, there are 442 patients in general wards, 268 on oxygen, 124 patients in ICU, 17 in high care, and 46 patients on ventilators. This proves that our hospitals are not overflowing. The reports by some media houses that were no spare beds in East London hospitals is factually incorrect and false. Yes, the unfortunate situation is that anyone who feels struggling with breathing, etc., everyone is looking for ICU, everyone is looking for high care. This is where the challenge we have. And almost everyone who's got a medical aid believes that that person can only be well looked after in the private hospital. There is no cure for this. Our public hospitals have actually shown a great strides in handling and dealing with this. Kwagqirha nasesibhedlele unyangelwa intloko xa unentloko awunyangelwa i-COVID because alikho ichiza le-COVID. Sikunika i-oxygen, sikugcine, sikugadile khona ukuze ezinye izinto esinokwazi uzinqanda sizinqande. So nanso into eyenzekayo. Ilishwa ke ezibhedi nazo kwi-private hospitals zimbalwa and wonke umuntu urhalela ukuya kuzo. Baninzi abantu andibanqandileyo ngokwam befole kwii-ambulances okanye kwii-parking areas ezimotweni zabo belindele ibhedi kwii-private hospitals. Ndithi hamba yiye emakhiwane, zikhona ibhedi phaa. And many of those people survived. not in private hospitals, but in our public hospitals. So we still want to encourage our people to really make use of these public hospitals. But abantu bakuthi mabaye esibhedlele kwangexesha ingakumbi abo bane-comorbidities. Into uzigcina endlini usithi hayi awuvanto kodwa uyazazi into okokuba unesigulo onaso uyothi ngomzuzu wokugqibela ubheke esibhedlele. Yile nto siba nengxaki yabantu abaswelekela ezigeyithini nakwii-casualties ezibhedlele zethu. Kuba abantu bakuthi abanazo ezi oximeters zozitshekisha i-oxygen in their homes. They also don't have this oxygen support in their comfort of their homes. So phaya ezibhedlele siqinisekisa uba i-oxygen ikhona. All our beds that have been identified are oxygenated. We're also providing these ventilators to ensure that we support our people. The sensationalism and fake news is really causing our people unnecessary panic. We want to condemn such misinformation with contempt it deserves. It doesn't necessarily mean that we don't have challenges of efficiencies in certain hospitals. Those challenges are there. For instance, over the weekend I had a call and a complaint from Dr. Malizompehle Hospital, apho bekuthiwa kuphele khona i-oxygen, simply because the hospital didn't order enough oxygen on time. And when oxygen was needed, it was not available. And I've said to the department, in such cases, we can't smile. We can't tolerate this mediocre performance from our managers. We must actually have consequences. People have lost their loved ones because there were no oxygen, not because oxygen is not supplied. I'm going to speak about that oxygen part at a later stage. But it's simply the issue of leadership in that particular hospital and other hospitals where you find this. So there are people employed to make sure that oxygen is forever available in hospital. And we're going to take quite serious steps in such cases. People must explain why such negligence would have been allowed to take place. It is important to also emphasize that if our people don't comply with infection control measures and protocols, they will be infected with the virus and they will continue spreading COVID-19 to other people. If and when more people get infected, majority of those might need hospitalization, and our health system, just like any health system in the world, will be stressed beyond its capability. That's a fact. Tied to the availability of beds is the efficient supply of oxygen in our hospitals, which is essential for COVID-19 patients. AFROX has committed to meet oxygen demands of our hospitals throughout the festive season. Our hospitals are actively monitoring the supply side of oxygen. Oxygen depots are not closing for the festive and public holidays. At Grey Hospital, installation of an oxygen tank is completed, and the hospital is currently supplied out of a bulk tank. At Victoria Hospital in Alice, oxygen was commissioned on 3rd of December 2020. The hospital currently supplied out of bulk tank. At St. Harry Hospital, installation has been completed and the hospital is currently supplied out of bulk tank. I'm just mentioning the few because a lot of our hospitals across our districts have been done in the first wave, particularly between March and September. We've covered a lot of our hospitals that have never had such a kind of a service before. So I'm just highlighting the latest additions in terms of improving the supply of oxygen into our hospitals. The Nelson Mandela Academic Hospital will operate 40 ICU beds from St. Harry Hospital that we have just recently renovated. People would understand St. Henry. It has been a neglected hospital and a site in Mthatha. We've reworked it through public works. It's now a state-of-the-art hospital. At Mthatha General Hospital, installation has been completed and the hospital is busy finishing off their part of work. Once completed, AFROX will fill the tank and commission. At St. Barnabas Hospital, Elibode, the hospital casted the plinch on 3rd of December 2020 for a permanent position. A bulk oxygen tank is currently installed on temporal civils. The hospital will still need to connect pipelines, then AFROX can commission. At Statarim Hospital, bulk tank installation has been completed. The hospital still needs to install a pipeline connecting the vessel. Once completed, AFROX will fix the tank and commission. With regards to the availability of PPE and COVID-19 medicine dashboard, availability of PPE is at 87% in our hospitals. We top up these hospitals as and when they use their own stock to make sure that they always have PPE for health workers, support staff, and patients. With regards to COVID-19 medicine availability, our hospitals had 86% availability. Our depot had 82%, with supply having 95% availability of the medicines. The department, like the rest of the province and the government in general, has been affected by significant budget cuts, including COE. Over the remainder of the financial year and the medium-term expenditure framework, consequently, the EXCO has resolved for a possible reprieve to fund at least the most critical posts in general workers like porters and appointment of community service clinical staff who have finished their compulsory service. The issue of community health care workers remain an albatross as it is a national issue. We are exploring all possible means to fold this challenge to its logical conclusion. This issue, yabasebenzi abashotayo nabangashotiyo, challenges nayo apha Eastern Cape, as I've been explaining over a period of time, is that we are already at 65% on COE. That's a very unfortunate part because of the history of amalgamation of the three administrations in our province. This is a problem that we've been existing with. So we're paying workers 65% of provincial government budget. So we are left with 35% to deal with services to our people, the basic services, your infrastructure, schools, hospitals, etc. So it's not workable. We should not be there because government is meant to service the majority and the multitudes of our people. Yes, of course, creating jobs to those who must actually conduct such services. Due to the overall pressure on health system as a whole, finding available staff has become a challenge, especially for short-term contract appointments to deal with the current surge. In order to alleviate pressure on staff in health facilities, the Department of Health is roping in the services of caregivers who will deal with basic patient needs. Shortages in staff of ICU units are being addressed through the ongoing training of nurses who can then be deployed to ICU. ICU needs a specialized training, needs people with experience. Not every nurse can be in the ICU. That's the challenge that we have. The more we have people who are looking for critical high care beds and ICU, the more we have challenge. Because most of those nurses who would have been there have been aging. So replenishing that is quite critical and important, and this is what we are trying to do our level best on in actually allowing that upward mobility on the career path of our professional nurses. We are also resourcing our hospitals with new emergency vehicles. We have been actually providing the ambulances. I think it will be for the third time this time around with the latest that we have on ambulances. We have done it for already second times earlier this year, where we were actually giving out many ambulances out there. The challenge that we have is the turnaround on the fixing of ambulances when they've got breakdown. We are looking at that challenge and how best we can improve our efficiency and effectiveness. An ambulance cannot spend a month in the government garage or wherever it is. It must be understood that it's part of essential services. Because if it's not there, your essential workers won't be able to do their work. So at least we should be able to improve the turnaround on actually fixing the ambulances. It's not that they are old, they are not roadworthy, those who are in the repairs, but they need an urgent attention. So Department of Transport and Health are working on the best possible system to improve the efficiency in that space. I would like to take this moment to express our gratitude to a number of social partners as well who continue to offer humanitarian and solidarity assistance in support of our efforts to defeat the pandemic. They are our established OEMs in the province, especially Volkswagen, with the huge investment that they've done. We're currently working on them to make sure that we've got more oxygenated bed in our field hospital in Nelson Mandela. They continue with that investment that they committed earlier this year. We really appreciate that, and all other OEMs have donated, of course at different scales. We really appreciate that. Your Mercedes, your Isuzu, your Ford, they've been coming forward. One of the new regulations that were eased by the National Coronavirus Command Council relates to the traditional rite of circumcision. Our teams have conducted screening of initiates in all the targeted districts using primary health care centers and mobile clinics in partnership with the National Health Laboratory Services. We are also rolling out public education about processes and protocols for Ulwaluko using community radio station and SABC radio stations. To ensure compliance with the strict infection control regulation, the plan for this week is that the teams will be going around monitoring adherence and regulations such as that the parents have provided mask, water and soap for all the people emabhomeni. Sikhuthaza ke amanzi nesephu pa emabhomeni for obvious reasons, not really to sanitizing. We're really encouraging that people are using the water and soap pa emabhomeni. There is access to water for washing hands, while NGOs have pledged support with drinking water. There is appropriate space for social distancing emabhomeni, that all abakhwetha have gone through screening and COVID-19 testing. The Department of Health will continue monitoring adherence to the customary male initiation guidelines, especially looking at isiko itself, as well as dehydration and wellness of abakhwetha. We have, however, learned with great concern developments about the passing away of a traditional surgeon from Mthatha. Subsequent to that, we tested about 30 initiates that were in his initiation school, and 5 of those initiates tested positive to COVID-19. There is a serious outcome for us. This is a serious outcome for us, and we are looking into this matter as the Provincial Coronavirus Command Council in consultation with the traditional leaders. Umcimbi wokulusa abantwana ayingomcimbi wenkosi. Inkosi are custodians zamasiko ethu. Umcimbi wokulusa abantwana ngumcimbi wefamilies. Otata, omalume, obhuti, xa kuthiwa umntana usuka esuthwini, thathani uxanduva. Qwalaselani imeko yokuhlala kwabantwana esuthwini. Into yokuthathwa kwabantwana bayobekwa kwi-initiation schools, ulibale uyokumcinga mhla kuthiwa uyabuyiswa, yingxaki leyo. Umntana makajongwe noba ukwi-initiation school, mvizithele rhoqo, uqiniseke uba umntana ukwi-process right eya ebudodeni. Siyabacela abazali, le nto yomane kuthiwa hayi ngumcimbi wenkosi, iinkosi zinemizi yazo nabantwana bazo. Abantu ngabeenkosi, iinkosi zezabantu. So sukulinge uthatha uxanduva lakho ulinike omnye umuntu onengxaki zomzi wakhe, noba uyinkosi, noba ungupremier, noba ulilungu lepalamente, thatha uxanduva ngomntwana wakho. Siyayicela kakhulu loo nto leyo kubazali babakhathalela abantwana. Le meko ifana nqwa nale meko sijongene nayo ye-gender based violence. Kukuhlukunyezwa kwabantwana, uthatha abantwana aba less than 18 nabana 18 uyobafaka ebakhwetheni wogqiba ungabakhathaleli. Uthatha amaxhala abo uwaphose komnye umntu abadibana naye bumini kuba nje kuthiwa yingcibi loo mntu. Siyacela amadoda elali enze le nto iqhele ukwenziwa yokuhamba ayokroba ebhumeni ajonge umntwana, kuba umkhwetha osebhumeni luxanduva lendoda. Eminye imizi ayinabo tata, kodwa umntu ngumntu ngabantu. Siyabacela abantu basincede kule nto. Imbi into yokuba kubulawa abantwana. This is a really direct child abuse or children abuse if abantwana bathi ngokuya kwisiko lokwaluka ibe kanti kukupheliswa kobomi babo. We want to repeat the fact that ulwaluko is the sole responsibility of families, parents, and guardians working closely with their traditional leaders as custodian of our culture. The fact that government has eased the regulation does not mean parents should rush their children during this pandemic. Le ntsomi sivayo kubazali bayi abantwana bafuna ucommit suicide. Abantwana, we are at war. We are at war. History tells us inkosi zezo lakuthi onkosi umhlonto baphume ethontweni bengabakhwetha bawukhusela isizwe samampondomise. We want patriots. Sifuna abantu abayi-understandayo imeko esikuyo. Ubude abuphangwa. Ubude abuphangwa. Sicela abantu bayazi ba ubudoda asiyo fashion. Luxanduva ozawuba nalo wakuba kuthiwe uyindoda. So le nto yongathi ubudoda ifashion kuba ndise-university ayikho right. Kuthi nangexesha loba sisemfazweni sisilwa notshaba osungaliboniyo kubekho abantu abaqonda uba banawukwazi bona unyamezela to a point that their parents cannot look at them in their eyes and say, no, my child, you are not going to go there. You are going to go there when a situation is normal. Situation is now abnormal. So we still want to appeal to parents to understand and konke ukhona umzali ofuna usumntana akhe esuthwini kuba enenjongo zokokuba asweleke. It becomes a serious pain when lamgidi utshintshwa ngoku ube sisingcwabo. We are now in the 3rd week of December, the height of the summer holiday. Sadly, we have already had 82 fatal crashes since the beginning of December, resulting to the death of 113 people in our province, 23 drivers, 40 passengers, and 50 pedestrians. It is concerning that speeding, overloading, drunk driving are still some of the contributing factors to accidents on our roads, when every year government educates motorists about road safety. Noko masingakhamanzi ngebheklevu zayo. Akukho mntu unelicense ongakhanga ye-driving school afundisa u-K53. Le nto bakuthi xa iweather itshintsha kubakho imvula enethayo silindele uquluka ubhode ezindleleni, abantu baqhuba unothanda, abantu abakhathalelanga ubomi babantu ababalayishileyo, abantu baleqa ibhizinesi ngobomi babantu. Noko siyacela oodrayiva bethu make balandele imithetho yezendlela. Indlela zonke zethu zibhalwe izilumkiso. I-high accident zone ziyaziwa apho imoto zityibilika khona xa kunethayo. Izi-speed limit zibhaliwe. Abantu abalandeli imigaqo yezendlela. Simple. Siyabacela abantu bakuthi bake bathobele umthetho. Asizifuni ezi ngozi kuba zisinika uxinezelelo noxanduva oluphaya ezibhedlele. Noko ingozi siyakwazi uzilawula, siyakwazi uzibona sinemithetho. Asikwazi uyibona ncama, asikwazi uyilawula i-coronavirus. Yenzeka singaqondi. Asina choice. So our hospitals must not really be overburdened by things that we can control as responsible adults, as responsible citizens. We want patriots. We want people who understand where the country is, where the world is. What can I do as a person? At least we want to encourage this selflessness from our people. We want to see this patriotic commitment that our people show. Think about other people. who are just driving normally in their roads, we simply come and crash at them because wena awulandelanga imithetho yezendlela. We appeal to road users to work with government and law enforcement agencies in reducing the number of crashes on our roads. We are in the middle of a second wave of COVID-19, and our health system cannot cope with the additional pressure from victims of road accidents. Responsible driving and general adherence to the rules of the road will ensure that we do not add unwarranted pressure to the health system. In the last week, the MEC for Transport, Safety and Licensing, MEC Weziwetikana, got handed over 3 new mobile vehicle testing stations, 3 buses fitted with automatic number plate recognition system, as well as 8 new motorbikes. These are much needed tools of trade which will enhance traffic law enforcement operation in our province. We are satisfied that the 24/7 2020 Road Safety Festive Season campaign, which we approved as the Executive Council, is being implemented. We wish to once again appreciate our officers who continue to show bravery at a time like this, heightening law enforcement visibility on the road as one of the efforts to reduce the demise of our people brought by road crashes. As the summer season is a time for relaxation and fun with families, it is also time for traveling. Travelers are more aware of the need of social distancing and health protocols. The tourism industry echoes this sentiment through the practicing of strict industry protocols, safety measures, and overall provision of awareness on traveling safely and responsible. In light of the current pandemic, there is definitely a drop in inter-provincial travel as people are experiencing different effects of the pandemic that have been affected by the economic status. Provincial tourism performance for 4th quarter of 2019, 1st October to 31st December, saw 1.3 million people coming into the province to visit or stay with friends and families. This was a drop compared to the same period in 2018 that saw 1.33 million people visit to our province. This picture is projected to decrease further in 2020 due to the provincial impact COVID-19 has had on livelihoods and travelers. We remain hopeful that the recent spike of COVID-19 cases in our coastal cities will be minimal on tourism as we move swiftly to close beaches and to save lives. We recently saw the seasonal adjusted income from accommodation, for example, increase by 56.7% month to month since September 2020. This is a good sign, and all tourism establishments, such as hotels and B&Bs and other attractions, remain open in our province. People can still enjoy our splendor. Our hotels are not closed, as we are not in the lockdown. Eastern Cape remains an adventure province, and indeed it remains yours to explore. Our message to those coming to the Eastern Cape is that please observe all COVID-19 protocols so that we save lives during this pandemic. We'll also have heightened police visibility, which will be focused on checking roadworthiness of vehicles, crimes committed along the national roads, taverns not complying with liquor regulations, monitoring of compliance with curfew restriction and disaster management restriction gatherings, wearing of masks, and social distancing. I've seen people warning other people in the social media that curfew is law, is regulation. If you commit things outside curfew, if you get yourself involved with your car accident outside curfew, you are likely to experience more hardship, more problems, even with your insurances, because it is outside the law. So this thing of curfew, it must not just be taken for granted. You look for police, look for yourself. You're supposed to be where you are at that time, not in a wrong place, or you will really suffer the consequences. All the operational forces have started reporting on the state of the beaches, and all the operational feedbacks indicate that our beaches are quiet, and that people have heeded the call of government to stay away from these beaches to stop the potential spread of the virus. We are not just doing this for fun. If one event in KZN called the Rage for Kids from Gauteng, they come together, 1,000 plus, on their way back home, more than 900 of those kids have tested positive. It's not a joke. With the multitudes that we see on our beaches, it's a problem. So any caring government under the constitutional democracy, government of the people, for the people, by the people, must always look for the majority interests of people, must always cover their backs, must always think for our people. We are doing that to save lives. And as a province, in our analysis, we have looked at the 2 last weeks of December and the first week of January, at least the 3 weeks, if we can make this kind of a tight restriction, getting our people in their homes, out of all these public places, surely we can cause this kind of dent that we want to see in this virus. So we are really pleading to our people, even if you come back home from Johannesburg, elsewhere, so stay at home, enjoy your family. You have been missing your family for the whole year. Enjoy your family. You at least will see friends. You can visit friends at some other time. Protect your family. Because if you leave your family to friends, you are likely to contract the virus and bring it to your family. As you leave back to work, you are leaving a disaster behind. You are leaving parents decimating. So please, make sure that you take serious responsibility at this time around. So we don't want soldiers. We don't want police to police you for your life and the life of your family. Police yourself, at least take responsibility. We are at war. I've never seen spectators in a war. Everyone in a war like this is at war. We must all be combat ready to ensure that we fight this enemy. Our common enemy now is COVID-19, which is likely to destroy the world, likely to destroy the country, likely to destroy the province if we don't behave normally. Government has done everything, has embarked on a massive awareness campaign, has provided all what government can do. Now we want our people to stand up as patriots, to raise their hand, join hands, work with government, all hands on the deck, put shoulders on the wheel. That's what we are looking for. That's a plea that we are really looking for, sending it out to everyone to at least come on board and work with us, save more lives. We note that some people have decided to take government to court. We are looking at that process with keen interest. We respect courts of law. We respect the constitution of this country. But this time around, you needed the high level of vigilance, high level of patriotism. We took this decision as EXCO in October in anticipation of what we are seeing.
Unmute, Premier, please.
Almost
for 2 minutes, we did not hear you.
We took this decision as early as October. We made this submission as province to the National Coronavirus Command Council for the President to arrive at that. We know the state of our province. We can't behave as if we don't know the situation in the province. We won't have hospitals to admit people who will be infected in our beaches. There will never be such capacity. Now, as I normally say, that probably Stats SA must consider doing census in December to get a true picture and a reflection of the population of provinces. You know, every people are coming back home now. And unfortunately, people of Eastern Cape are forced to live dual life. They must live life here. They must live life somewhere, because that has been designed like that for years from the colonial system and more exacerbated by the apartheid system. It's something that we must look at it and find a way of integrating Eastern Cape back to the national economic space. We keep on raising this point that we might be peripheral to the center, but we remain the center of the periphery. So we definitely need everyone to understand that kind of context when you are dealing with Eastern Cape. Now people are living best hospitals that government has invested in, both private and public, in big cities. They are coming here. And numbers are more here. If people get sick at this time in the Eastern Cape, we'll have more problems over and above the challenges that we are confronting. Hence our plea that our people must work with us. Our people must collaborate with us, must cooperate on these kind of a scientifically approved non-pharmaceutical interventions we're making. So we're looking at our people to really understand what we are trying to do. All the